right. Hi, welcome everyone. Thank you so much for joining us today for the Kids in Crisis Helping Kids Thrive Wellness Series. My name is Denise Quayle and I'm the Managing Director of Kids in Crisis. And for those of you that may not know, Kids in Crisis is a 24-hour emergency shelter and crisis intervention program for children newborn to 17. And please visit our website at kidsincrisis.org and get all the information about our services and resources. But I will tell you our helpline is 203-661-1911, and that's manned 24/7. So I first want to welcome our guests for today's topic, which is about nutrition, eating disorders during COVID and how this has impacted kids and families. And our two wonderful guests here are experts, Dr. Janet Lydecker and Lisa Bunce. And I'll first say that Dr. Lydecker is a clinical psychologist from Yale School of Medicine. She's the director of Teen POWER at Yale, which is a research clinic working to improve treatments for teens and eating disorders, as well as teens who have been bullied because of their weight. And Lisa is a registered dietitian and nutritionist. She's the owner of Back to Basics Nutrition Consulting, located in Reading. Her past experience includes writing for both professional and consumer publications in the area of nutrition, health, and wellness. And in addition to her private practice, she is currently an adjunct professor at Fairfield University, Quinnipiac University, and Norwalk Community College. And she enjoys her work in helping people make positive changes in their lives. So thank you both so much today. We will be recording this program and it will be found on our website for future use if anyone wants to refer someone to it. And I'll be manning the chat box if anyone wants to put in some questions, and I will be the only one that can see that and I can answer any questions you may have. But we have some questions already from previous requests. And let me start by just saying to both of you, what in your experience and what you've been doing in your work, have you seen COVID, how it's impacted our nutrition, our activity, our wellness? Janet, why don't you start?
Sure, I'm happy to. So I work with teens who have eating disorders and also higher weight, and we've actually seen both of those independently increase over COVID. So we've seen some weight gain. We've also seen an increase in eating disorders and disordered eating. In particular, if you think about what kids' experience was like during COVID, there was a lot less going on. So there's a lot more time at home, more boredom, more stress from school, especially directing their own schedule and assignments when schooling was remote. And all of that stress paired with the boredom, and not to mention all the stress from the world, really did change eating behaviors and lead to more stress eating, binge eating, boredom eating, and then more panic and wanting to control, which led to more restriction. So we've seen an increase in all of it over the past couple of years. Lisa, have you seen the same?
Oh, absolutely. The stress-related eating, threefold. And when we think, and the best way I can describe it is when we think in terms of food, food is important because it nourishes us, it keeps us alive. It's also part of our celebrations as well, which is important. We socialize with it. But then there's a component of food that soothes us and we use as a coping strategy. And, when we can keep all three of those in balance, it's fine. That's balance and moderation. But what I was finding, and I continued with telehealth throughout COVID, was that many of my clients, old and new, were finding that balancing act became more difficult, that the coping strategies, utilizing food as a coping strategy, became much more prevalent. And, when we think in terms of relating it to teens, you bring up excellent points, Janet. And teens also at that point, I found I would think of my own children because I have a teen and a 20-something-year-old. That time of life, they're supposed to be out with their friends, with their peers, getting ready to launch. And so food did take on a comfort component. And then, as you pointed out so beautifully, if their weight started to go up, then that control and restriction develops. So there was a lot of pendulum swing through that 12 to 16 months.
Oh, definitely. You reminded me of actually one of the positives of these past couple of years with the telehealth. So we used to see everyone in person. We'd bring them in, we'd do a weight, we'd do one-on-one individual counseling, and all of a sudden we couldn't do that anymore. But it ended up being a really great transition that we probably wouldn't have thought to do or had the resources to do without the necessity. But we've had such great experience. We now do individual therapy or family therapy on Zoom. And it's so much easier on teens. They feel like they have more privacy because no one's seeing them walk into a clinic.
Exactly.
Not something we had thought about before, but it's been a great benefit. And we see more into their lives. So we hear when someone's banging on the bedroom door, or you know, we say, why don't you go grab dad and have him join our family session when we're talking about him. So there has been a silver lining, at least from the therapeutic sense. We're not going back. We love this telehealth. We might make it optional at some point, but for now, everyone seems to be choosing the telehealth.
Interesting, interesting. You know, when people think about eating and nutrition, understanding what a balanced diet is and maybe what disordered eating is, maybe we could talk about that a little bit. Lisa, can you talk a little bit about what a balanced diet is? Because I think it kind of got skewed maybe during the pandemic.
So it's not like fun and interesting and trendy like we see, you know, in social media, but that concept, and it's very boring, and sometimes people get frustrated with it, that concept of variety, balance, and moderation is key. And so when we think in terms of variety, it's a variety of all foods, all groups of foods, and then variety within each food group. So not focusing on one particular food item within a certain group, because not one particular food item can give you the nutrients that you need as not one particular food group. So when we think in terms of balanced eating, what's really important is to assess what your likes and dislikes are, assess what you may or may not have allergies to, or perhaps you are trying to eat more plant forward and you prefer to move more towards a plant-based diet, towards some form of vegetarianism or veganism. And that's all fine and good, because all types of eating styles can work as long as you make up those nutrient deficiencies. So I think a good example is many adolescents will come in and say, I want to be a vegetarian, or I want to be a vegan. And they take everything out of their diet and they focus on bread or pasta. And not that bread or pasta is bad. It's just that if that's all you're focusing on, you're missing all those other nutrients. So creating a eating style that fits your ethical values, that fits your likes and dislikes, that fits the convenience of where you are in your stage of life, and is meeting your nutrient needs at the same time, is a balanced diet.
Yeah. As a psychologist, we do a lot of the same, in a much more basic way, psychoeducation about how you can eliminate any food group. But we also, with eating disorders, will focus on regular eating. So not going too long in between meals or snacks. What we often see is people get so fixated on the binge that they think, well, if I'm going to binge later, I should have fewer calories before. But that actually makes you more likely to have a binge because of that restriction. And so the first thing we'll do when someone starts with our clinic is have them do a week or 2 weeks of food records. And we look at that timing, and then we worry about, well, what's the content of each time? Because any big gap is a problem.
And I would absolutely agree with you, Janet, on that. Encouraging backfilling your day with nutrient-dense foods at specific times to stabilize blood sugar levels so that you're not having those cravings. And for many, though, that regularity of eating is also a challenge. And even within the population of someone suffering from an eating disorder, as you probably can attest to, there's a focus on an emphasis on either clean eating or specific types of foods that are acceptable. So working in that realm as well, in very small behavioral changes, to help them also expand beyond those fear types of foods as well.
Yes, that variety and that moderation as opposed to being off limits.
Right, exactly.
Mm-hmm. And when do these things that if it gets, when they're not doing variety, balance, moderation and all that, how can someone see if it's turning towards something of a more serious nature? Like when does it become an eating disorder?
So, Janet, do you want to speak to that first, or?
Sure, I'm happy to. So I won't touch the three nutrition principles because I love that trifecta, but I haven't heard it before today. With what we're looking at some of the thinking and emotion that's tied to food, whether it's eating or not eating. And when it becomes to the level where it's impairing other areas of someone's life, that's when we'd say this has crossed into an eating disorder. Whether it's one of the specific diagnoses or just that larger category is less important than whether it's impairing the functioning. So if it's getting in the way of family relationships, friend relationships, if schoolwork is slipping, all of those are signals that there's something going on that's an eating disorder level. I'll let you take on the nutrition principles.
And the only thing I might add to that too is I certainly look at that as well. You know, how is it impacting their day-to-day living and their relationships? But then also I look at their exercise patterns as well, because sometimes that's a pathway towards control of excessive exercising and keeping their weight in check. And so like you, I do encourage weigh-ins, whether it's blind weight or not, and that's the client's choice, and we talk about that. Yes, so if they become fixated on certain foods, if they are limiting the scope of not only the types of foods that they're selecting, but the amount, if the way the food is being prepared also becomes an emphasis of concern. So anytime the food selections are being put under a microscope, let's say, that's when I begin to become concerned, whether the client themselves are sharing it with me or a family member is sharing those concerns. Also, too, another telltale sign is if they start to eat alone by themselves, where I often ask them, you know, a lot of environmental questions. Who are you eating with? Where are you eating? You know, in addition to when are you eating?
Yeah. Is there some gender or person or age that's more prone to this than others? And I also wanted to ask, what does a blind weight mean?
So blind weight is getting on backwards on the scale so that they're unaware of what their weight is. Because sometimes individuals who are suffering with some type of eating disorder are uncomfortable knowing what their weight is, and it actually can trigger either a binge or can trigger more restriction. But when I work with clients who are suffering from an eating disorder, I always am very specific that we can do blind weights, but the intent is to eventually get to the point where you're aware of the changes. First, it's usually they'll accept that there's an up or a down, an increase or a loss, and that eventually we get to the point where they're aware of their weight, because taking ownership is very important.
And that's a bit of a discipline difference. We're getting at the same goal, but in psychology, we won't typically do a blind weight because it gives the weight more power. And it's very hard to actually do the therapy around the thoughts and the emotions if we've kind of allowed the avoidance in that hour. And so we talk usually in quite a lot of detail before a session or before the weight is done about how this is part of what we do in the therapy setting. But again, same goal. And with many of these teens, they have interdisciplinary treatment teams. And so it end up getting a lot of weights, which isn't as necessary. We want that awareness, whether it comes in the moment like we prefer or as the goal. So I love that. I'm forgetting your other question, Denise. I got so fixated.
Me too on blind weight. No, the kind of who's trending towards this, and we're mentioning teens, but is it in families? If parents have it, if kids have it, like are girls more prone, athletes more prone? What are you seeing?
Can't believe I forgot that you asked that, because that's actually my number one thing that I like to make sure people know. So eating disorders just don't discriminate. So there are some groups where it might be more likely to happen or you see more people affected, but it's important to know that no matter what demographic variable you come up with, eating disorders are possible. So my work looks in particular at individuals with a larger body or a higher weight and how they can also and do have eating disorders. And all eating disorders. So you can have anorexia with a larger body. It's just defined slightly differently in terms of weight loss instead of where someone ends up. But we see all races, we see all genders, we see all professions, we see all ages. So it's not just teens, even though that's who we're focusing on today.
Mm-hmm.
Lisa, I'm sure you see all walks of life in your practice as well.
Absolutely, some form of a disordered eating style throughout. I would say though that I do, it is throughout all walks of life, but, and correct me if I'm wrong, Janet, I get the sense that it gets that in adolescence, middle school, early high school years, that's when if there's a tendency towards that, it may, again, flip the switch at that point or get triggered at that point.
Yeah, I think the statistics are that the purging, if you think about bulimia, vomiting, taking laxatives, exercising to get rid of calories or weight, I think it starts in late elementary or early middle, but it just gets more common as you go throughout high school. So we really are looking at middle school, high school, college, and kind of mid-20s.
I feel like social media also plays a huge role at that point as well, too. They're very tapped in. And that's where I also feel like COVID did a disservice, because preventing them from participating, not that they do a lot, teens do rely heavily on, they rely on social media for their communication or their mirroring their behaviors. But I feel like COVID, preventing them to be out among their peers, put them more in front of the screen. And that also accentuated what may have been brewing.
So true. We've seen and we've heard teens reflecting just that there were good things about social media, but there was just too much, that the negative definitely came in over COVID because there was just so much social media use in general.
Right. Those are habits that maybe are going to linger with COVID, what we got into so much online and being home. Yeah.
Mm-hmm.
Are there other mental health issues that might be related to this that we should think about or be aware of, signs of?
Yeah. So eating disorders have a lot of comorbidities. So when a psychologist is seeing a brand new patient, we might do a structured interview and go over all of the possible diagnoses as a way of figuring out what needs to be prioritized in treatment. So we see PTSD, post-traumatic stress disorder, and trauma. We see substance use, alcohol use, depression, anxiety, often OCD or panic attacks. I'm probably missing some, but those are the ones that I see all the time.
Right.
It's almost, I would say, the rule rather than the exception to have more than one thing going on, even if the eating disorder is the clear priority for treatment.
Mhm. Would
I would
you?
agree. Yeah, I would agree.
So that kind of brings a challenge to families of finding the right source of help in terms of what kind of providers, who should I be looking for? When is it a dietitian? When is it a nutritionist? When is it a psychologist? Is it all the above? How do people know?
So in my practice, it's all of the above. So they may seek me out first, and as you and I had spoke earlier, seeking out a registered dietitian, and there's eatright.org where you can find the dietitian by zip code. They may find me first, and then I network with their physician and a therapist. If they don't have a therapist, I make a referral. And then it's been the reverse as well, where they've reached out to a therapist and a therapist says, okay, we need a higher level of care. And then together we're working. But I find that clients, regardless of age, when they're struggling with some type of disordered eating style, they do best with the three-prong approach of dietitian, a therapist in some form, whether it's a social worker, psychologist, a psychiatrist, whatever it is that their needs are, along with the physician. Seems, in my opinion, the best outcome.
Yeah, I would agree. I think that's definitely true when we're talking about anorexia. So that severe restriction, and with some of the bulimia and binge eating cases, but it is also patient dependent when we talk more about bulimia and binge eating, where sometimes it's caught early and therapy is the only thing that is really needed. We always involve the pediatrician, or at least have the family make sure that the pediatrician knows that this is a thing, that this was part of the medical experience. But I would not see a patient with anorexia without a dietitian and pediatrician, and often a psychiatrist on board. I do want to just say mental health, there's a lot of different professions. There's a lot of overlap among them, and the fit with the therapist and also the specialty of the therapist is more important than what the title is.
Right.
So I'm a psychologist. I happen to be a counseling psychologist, so I see the whole lifespan and focus on kids. But a psychiatrist can do therapy, and also they do medication, which other therapists do not. Social workers are fantastic therapists, or counseling master's level. So it really depends on that experience and comfort working with eating disorders, more so than whether someone's a doctor or master's, or what their discipline is.
Right, and I would say in the nutrition field, making sure there was an RD after the name, but even within that, some of us specialize in eating disorders, some of us specialize in bariatrics, pediatrics. So finding the fit, following your gut instinct, finding that fit because it is all about trust. So I'm not opposed when people call me up and they ask me, look, I got your name. I'd like to ask you just a few questions.
Oh,
and they're really just trying me on for size. Do they like my approach? Do they like what I'm saying? Do we feel as though we can work together and meet their objectives?
Mm-hmm.
It's occurring to me, in therapy, we often say the best exercise is the exercise you'll actually do. The best foods to eat are the ones you'll actually eat.
Right.
But
Exactly.
the best therapists in all of our professions are the one you'll actually go and see and talk to. If you're going to just check the box and show up, or say, oh yeah, I'm being followed by so-and-so, That's
Right,
not.
exactly.
It is about the work. Yeah, it is about being there 100%. When you think about that now, talk about healthy snacks and healthy eating. What are good foods? Is fast food a total rule out? What do you think?
No, I don't think fast foods are to avoid. I think we can select healthy alternatives within fast foods. I think utilizing convenience foods appropriately is very possible. And the grab and go mentality within your house is also very possible. But it's all about engineering your kitchen to allow that grab and go, right? So that's why we like the cookies and the pretzels and all of that, because you can rip the bag open and reach in. But if we can engineer our kitchen to have more healthy alternatives, things that are more nutrient dense and not as calorically dense. Nuts, cheeses, fruits, vegetables. If we could engineer our kitchen to have that visible or available, quick and easy to grab, that's wonderful. And it would be the same thing in a fast food restaurant. Sometimes we need that convenience. We're on the run, but there's selections within that may be more appropriate. And if you do find yourself choosing a more inappropriate food item, a general rule of thumb is an 80-20 rule. 20% of the time, you have that ability to choose things that may not have as much nutrition in it, maybe more calorically dense. But 80% of the time, try to make better selections, and then it all balances out.
I love that. That's such a helpful rule, that 80-20 split.
I do too.
So
When I
it
think
breaks,
of kids having to choose at cafeterias and,
right.
if you're not comfortable eating in public, or if size is an issue, I think of
Right.
what you deal with, Janet, with the bullying.
Mhm.
Kids spend so much time during the day out of the house and school. How do they manage eating?
Mhm.
Right.
And not eating is not an option.
Right.
Right, exactly. Another way to look at that 80-20 is there are 21 meals in the week. If you get 18 of them correct, you've got 3 opportunities to not be totally nutritious all the time. So that also is kind of another frame of reference, like, okay, I didn't eat well at lunch today, but I'll eat better tonight. Or I've already had a couple of meals this week that weren't on target. I should really try to make it more specific. And I know that all sounds very vague. But again, if we're bringing in food items that are rich in nutrition and low in calories, so yogurts, fruits, vegetables, healthy grains, nuts and seeds, and leaving the chips, the pretzels, the cookies, the cakes, the higher, like more of the snacky type foods to a minimum, we can balance our weight and we can balance our health.
I love that, because so many of our eating disorder patients have these really rigid rules around what they eat and when they eat. And so whenever we can challenge with a way to have more flexibility, it's uncomfortable, don't get me wrong.
Right.
It's never something that they go, oh yeah, I love that rule, like we just
Right.
did. But it's something that I think shows growth and ultimately feels relaxing to say, I'm not out of control. I have this guideline,
Right.
and that means I don't have to be 100% following my rigid rules every day, every minute of every day of every week.
Shows some flexibility.
Yeah.
Mhm. With the teen schedule being as erratic as it is. So if we're talking about this later on, what is the early interventions and the prevention things we can do as parents of all ages?
Could I answer that first?
Mhm. Go for it.
Eat well themselves. That is the #1 rule. If you are not eating well as a parent, you cannot expect your child to eat well. And you are their role model, and they are going to mimic you, whether it's healthy eating, overeating, disordered style of eating. And I think you would agree, Janet, in that there is research out there that an eating disorder or anorexia, there is a, I don't want to say a genetic predisposition.
Well, there is a genetic component,
Yeah,
but there's also that environmental component.
Right, exactly. So if as parents, we have a huge responsibility from day one to nourish our children and to be healthy role models ourselves.
Yeah, I love that idea of role modeling. I think that's it's actually a lot of pressure on parents to say, well, no, your kids are watching everything that you eat and listening to everything you say.
Right.
We focus a lot because the questions I get are about how to talk to kids about their eating and about their body image. And it's hard. It's one of those things that role modeling is still the answer. So if parents are aware of when they say negative things about their own body or about a stranger on the street or about their child is taking that in, and kids and teens are pretty sensitive to things that their parents might be saying, even when they pretend that they're not. But it can get it at an internal critical dialogue that then leads down the road to disordered eating for some.
And even the most basic of, if they're not eating their vegetables, they can't expect their children to eat vegetables. So there's even that practicality side of it as well. So I agree with you 100%. The messaging and how information is being presented and how they may discuss eating or what's happening at the dinner table, or whether they're actually even sitting at the dinner table. And I know everybody is very busy right now. And maybe perhaps one of the silver linings of COVID was, for some, it did bring them back to the dinner table, which could have been good or bad, depending on who's sitting around the table with you. But it doesn't have to be dinner. It could be sharing breakfast together. It could be sharing a meal together. It could be a few opportunities throughout the week to eat together, to have that opportunity to share a meal. And I think, and I'll stop after this last comment, is that I find that if you're able to travel the world, and this was pre-COVID, people around the world were more concerned about who was around the table than what was on the table. Whereas Americans are more concerned about what's on the table versus who they're sharing their meals with. And we tend to be a culture of transitional style of eating, where we're always moving on to that next thing. And I don't want to speak for everybody, but the majority of individuals are moving on to the next thing. We're eating in front of the TV, we're eating in the car, we're eating in front of our computers, and we're not necessarily focused on the taste, the texture, the sharing of that meal, how that meal was being provided. And there's something of substance to that and appreciation to that. And when we get that disconnect, that's when these disordered styles of eating develop.
Definitely true. I do want to just take a minute to talk about when parents are concerned about weight gain or the weight of their child. Because often what I hear is that parents are afraid to say something because they're afraid of causing an eating disorder. So what I usually say in those situations is that the parents' value is that they want their child to be healthy, and it's okay to just name that. We go very quickly to connect weight and health, but if you just stick with the health, that tends to be, first of all, an easier conversation, and second of all, a more productive conversation, and then third of all, less likely to do harm. Nothing's perfect because kids will interpret things, but that's actually the parents' value and what they want to communicate. And so if you stick with that, that will hopefully help with some of those fears about causing an eating disorder. Do you ever get those questions, Lisa?
I do, absolutely. Like how to work, how to discuss it with my child. Every time I bring it up, my child backs off. I don't, or they'll be fighting about it. And I think it's important for the parents to be involved and be a supportive mechanism, but it is a very fine line between support and nagging and how the teen is perceiving that. And I find that the parents can tap in, and I certainly encourage that health connection, but I do find that teens don't necessarily resonate with the health message until they're like 35, 40 years old. So they resonate more with performance, like, or, the connection with school performance, this connection with musical performance, sports performance. And so I'll often position it that let's talk about what your body needs to do the things that you enjoy doing, and helping to support from that perspective, which is probably very similar to how you're approaching as well.
Yes, absolutely. Yeah, when I'm talking to a parent, I might connect more with their values, but I think you're right. That's the messaging that will work with teens. And I love framing it in terms of performance. That gets back to, if an eating disorder is impaired performance, how do we get you back to doing what you want to do?
Exactly.
That's very helpful. I was thinking just in terms of the pressure on parents to feel fearful that they're going to cause an eating disorder or question that, or not get into those conversations with kids. But as far as role modeling, that they're not perfect, nobody's perfect, but being authentic about acknowledging maybe I didn't eat right today, but so that's why I really want to have a good meal tonight, kind of role modeling the corrective approach too. What do you
And the
think?
compassion.
Yes.
So not being hard on yourself,
Right.
but restarting.
We're all human. I mean, even myself, I may do this as, to earn a living, but you can open my freezer and you're going to see ice cream in there. You're going to see cookies. And, so I struggle also, where do I stop? The food is available to me in my home. It's learning how to keep that all unbalanced. And Denise, I do like that reference to being authentic. Like, I'm not perfect either, but I'm working towards it.
I'm wondering if there are tips or things that we can think about that encourage positive body image, positive thinking about food, how we feel about those things. I loved the idea about the dinner table, about enjoying the taste and the people you're with, and that I think that was great. Are there other things?
Yeah,
Janet.
Sure. So a couple of things come to mind. Again, it's hard, and it's one of those things that it has to be a bunch of little moments that help encourage positive body image. So one thing we fight against in our profession is weight stigma. So our society has an extreme focus on weight being a standard of beauty and a standard of health. And it does real harm when it becomes a bias, that we stop seeing any possibility of health or attractiveness or functioning, anything good, any good qualities outside of a thin body. So with the little moments in encouraging body image, focusing on the function of the body. So what does the body do for you, and being grateful for that, either reflecting it from your own experience or helping a child to recognize that in their own, is a great way to go. And also naming any weight stigma that you do observe, so it doesn't just slide in under the radar and contribute to us having this stereotype of the thin ideal, but saying, that commercial used an individual who is overweight because they wanted him to be the funny one. I know that that's an example of a stereotype. And just saying that takes away that power for it to just slip in and reinforce the weight stigma. And ultimately, if you're combating weight stigma, that can help with positive body image. Anything to add, Lisa?
Anything, Lisa?
So with the teens, I often will encourage them to think in terms of shopping in stores that are reflective of their body type. And I often use my own daughter, who is now in her 20s, as an example. She was an athlete. She had a body composition that fit better in American Eagle and Gap style clothing, but her friends shopped in Abercrombie, which that's being tailored to a different body composition, small, and it's not even thinner, it's just smaller skeletal frame. And so I remember when my daughter was growing up, the struggles we would have when we were shopping. She wanted to go into Abercrombie and nothing would fit her because that's not how the clothes are designed. So encouraging teens to really look at, how can I look my best possible self in the clothes that fit me the best possible way? And it may not have the label of Abercrombie, but there's nothing wrong with American Eagle. And I don't even know if those stores still exist. I haven't been in a mall. I haven't been in a mall since pre-COVID. But that concept of wearing clothes that are still trendy, still in style, but are designed more for your body composition, and feeling good about that.
And that's such a good point, because it is something that teens need to be helped with, because the automatic is to do what my friends are doing. And so it is something that comes with maturity, that you do want to look your best, which might be a different store. It does become hard, become a problem when the bias is that someone's not cool for shopping at a certain store, and it becomes this bullying, teasing, like, oh, well, you can't shop at whatever store. You can't wear this particular uniform. You have to wear that other brand. And that's where some of that weight bullying, weight stigma can be really harmful. It's probably not objectively true. It might still be a trendy brand. It's just that somehow it's become, in the group of friends or on social media, just this uncool thing because of that body type.
Oh, I think kids are seeing so much of that, whether it's on TikTok, Instagram, social media, what the way they're supposed to look, whether it's the hair, the clothes, the weight, it's such pressure. And I think to have a child come home and be distraught about that, or not want to go to school. We have a lot of school refusal right now. And I want, some of it is for other reasons, but some of it may be they've been home for a long time and getting accustomed to not having to deal with that stress of judgment.
Right. And you're absolutely right. And to your point about the weight bullying and the dressing and looking the same, that's all part of adolescence, is fitting into that group. So the original question was, as far as building a positive body image, again, it's, helping them to understand, or if the question is geared towards the teens and their parents, is focusing on the things that are positive about them. And there's an exercise that I do with the teens where I have them make a list, and they don't share it with me, but I have them start at the top of their head and just write everything they like about themselves. It could be as basic as, I like the shape of my eyebrows, and just go down the list. They don't have to share it with anybody, but that they then use that when they're feeling down to kind of reinforce that, okay, it's not just the weight that defines me. There's so many other things. And also within that exercise, they write all the things that they're good at. Some are able to write volumes. Some of them are able to write one or two things. But at the very best, it helps them to shift away from, I am defined by my body. There's more to me than that.
Oh, a self-inventory of what's great about you. I love that. Someone was asking, is there a modality or a treatment that is particularly effective with someone that's struggling with an eating disorder?
can take the psychology perspective. So we do have evidence-based treatments, so treatments that have had at least a couple of research studies that have shown that they perform better than some other comparison group. Cognitive behavioral therapy tends to come out on top for eating disorders. It's also the most studied. There's also others that are closely related. So we do cognitive behavioral therapy in my clinic, so I'm also biased. I like it. Interpersonal therapy, there is dialectical behavior therapy. They're all closely related, but if you have something that has that science behind it, that tends to be a more recommended modality for treatment. Eating disorders are also complicated, so I'm mostly talking about outpatient therapy. So when you would see a therapist once, maybe twice a week, that tends to be CBT, but there are different levels of care too. So while CBT, cognitive behavioral therapy, would be across most levels of care, there's different ways it integrates in if you're in the hospital or if you're in a day program versus doing a 1 hour per week therapy.
Mm-hmm.
I saw you nod at CBT, Lisa.
Yeah. I agree with you. That is a very effective modality. With respect to the nutrition piece, certainly evidence-based is the way to go. But with nutrition, there's not one size of an eating style that is the prescription. Certainly if you're within a residential program, that's a different story. There are parameters that have to be met when you're within a residential program. But in an outpatient, you've got the luxury to work one-on-one to guide the individual from point A to point B, and helping them to expand their eating selections.
Mm-hmm. Absolutely. Absolutely. Is there any particular nutrients that teens are mostly deficient in?
So iron, zinc, calcium, dairy products tend to fall by the wayside in adolescence, whether they're moving more towards a plant-based diet and using plant alternative dairy products, which many of them are not. They're just eliminating it. They're because of sports or music practice or hanging out with their friends, again, pre-COVID. They may not be home for meals as much. They may be relying on eating over friends' homes, or maybe if, again, depending on what school district they're in, there may still be vending machines in place. So the iron, the zinc, which is found primarily in like good protein-rich food items, and then the calcium, which is found in dairy products. And then of course, fiber, because produce is not a big ticket item for anybody across this country. So produce, fiber is usually pretty low as well. So how do you compensate for that? Again, it comes back to those family meals. It comes back to helping them to perhaps plan and prep and bring with them to sports practices or theater auditions or after school activities, since everybody's back in school basically now. Helping them to understand the importance of getting up a few minutes early to wash down a glass of milk, grab a handful of cereal and a banana and eat it on the way to school. Like anything that could match their lifestyle. I think that's always the biggest challenge for me when I'm working with teens is I can't expect them to be getting up earlier, sitting at the breakfast table. So it's really matching or meeting them where they are and trying to incorporate in different types of food items that match their lifestyle, their likes and dislikes, and filling the nutrient gap.
What do you think about supplements though, and powders and fiber powders and vitamins? And
So I am a food first dietitian. There is no question about that. My first objective is to always help my client get the food first. Now, if I turn my screen around, you will see a whole shelf of supplements that I recommend, but it is always food first, because the definition of supplementation is what we can't get from our food, we then supplement. And so depending on where you are in your stage of life, supplements may be needed. And teens are a group where they have high nutritional needs with inferior eating styles. And then of course, if we're talking about disordered eating, that's a whole different spectrum. So filling in the gaps with supplements, whether it be a protein shake or an iron tablet, or maybe some B vitamins, or maybe some fish oils, but being very selective and making sure that what you're choosing not only is of good quality, but also is of need. Because oftentimes what people don't understand is that the human body is really interesting with respect to always wanting to be in homeostasis. And so oftentimes supplementation in a tablet form can displace the absorption of something else.
Oh.
So you need to be really careful when you're evaluating. And then even with respect to protein supplements, if it's not a complete protein like a whey, or even a pea protein now is usually combined with soy, you're just getting isolated amino acids, which are taxing your kidneys and your liver. So you need to, you need to be educated when you're going the supplement route.
Very helpful. Janet, any thoughts about that? The protein shakes and drinks that kids are using?
So we also try to do real food as opposed to protein shakes is normally what we talk about. We don't get into supplements too often, but we often get protein shakes when teens are trying to either pack on muscles or eat fewer calories. And so it becomes part of the disordered eating constellation of symptoms. And so for that reason, we try to just stick to real foods as much as we can. Again, not touching the iron or calcium or whatever it is that that they might have a deficit in. We're just on the lookout for that disordered eating.
Mm-hmm. And that deficit would be determined by blood work? Is
Yes.
that blood test?
Yeah. So they may come in and, again, it's such a broad range of symptoms. They might come in and be fatigued, but you might look and say, well, you're a teen, you're staying awake till 2 o'clock in the morning. So looking at the big picture first, and then if there is a question after evaluating their food intake, a simple blood work would help evaluate iron status, B12 status, folate status, electrolyte balances. All of those would be helpful.
Yeah. What are your thoughts about the consequences of substance abuse with teens and their nutrition and health? This is a time of experimentation. Kids may be dabbling in that as well. Older teens, young adults.
Right. So I can briefly answer that from a nutrition perspective. It does displace healthy eating. It will displace certain nutrients. It's calorically dense. So if we're on the spectrum of being overweight, that's additional calories that are being stored rather than utilized. I think it fuels the depression and the insecurities and the anxiety. So I know it's real, and it is part of the profile as you had described earlier, Janet, but I'm sure you could speak more to that.
Yeah, so we do worry about substance use whenever it's coming up as comorbid, so co-occurring with eating disorders. For a couple of reasons. One, it is empty calories. And so if we already have someone who's worried about their weight, whether they're under eating or overeating, if they're worried about their weight, it's one of those, is it worth it conversations, but it is also a depressant. So from a mental health perspective, it is going to make depression worse. It's going to make anxiety worse. It's going to make insomnia worse. And it can make eating disorders worse. It reduces some of those inhibitions. So if it's an impulsive binge that's happening, it lowers that threshold so that it's more likely to slip into a binge, as well as what we pair with alcohol. It's very rarely just drinking alone. There's usually snacks and sweets and salty around. And so you're having that environmental trigger or temptation, as well as the reduced inhibitions that can set you up for disordered eating. And then we also worry about self-harm. So where depression is increased with alcohol and other substances, it's also more likely that self-injury or a suicide attempt would be made. And so we're always thinking about what is the full picture, mental health wise, environmentally, what's going on.
The whole package, again, looking at the whole person. Thank you very much. Well, I can't thank you both enough. I do want to take a moment just to share a resource page that you both shared, such great resources for people to follow up on these kind of topics and issues and questions they may have. So Paula, if you want to share the resources, we'll email this to everybody that registered, but it'll also be on the Kids in Crisis website. So thank you very much. Any final comments that either of you want to make that maybe we didn't touch on or a question didn't come up about that you think is critical?
I would just encourage people, if they do suspect an eating disorder in themselves or in someone they know, to not just wait and see, but to have a conversation, seek help, get an evaluation. I usually recommend pediatricians first, or finding a therapist to do an evaluation and see what's going on. But eating disorders can become serious very quickly. Bullying can turn into an eating disorder. So my message that I would love everyone to hear is, if you notice or suspect, don't wait, but get more information.
Absolutely. The earlier, the better. Thank you. I hear that. Lisa, any final thought?
I would say ditto to that. And also just, in this time of stress and craziness in our world, is to just really seek out ways for self-love and seek out ways for self-care, whether it's, taking a bath or doing a manicure or whatever it may be, just really trying desperately to just really look at your own self-value and against everything that we see in this world. And I know that's easier said than done.
Oh, I appreciate that. I agree. Do that self-inventory of all the great things about you, because everyone has something.
Exactly. Focus on the positive, not the negative.
Yeah, thank you. Well, thank you both very, very much, Janet, Lisa, spending this hour with us. I really appreciate it.
Thank you for having us.
Yeah, thank you for having me.